Hello everyone. Today I'll be discussing 10 fundamental principles of plastic surgery. So, the first principle, make an informed decision to operate or not operate. That means not every defect needs a surgery. The surgeon must weigh benefits versus risks and consider patient's expectations also. The second principle is to optimize modifiable patient factors. That is smoking, diabetes, obesity, infection, and malnutrition, which can impair healing. Optimization before surgery improves the outcomes. The third principle is performing adequate debridement before we do any reconstruction. A wound must be cleaned thoroughly and healthy before reconstruction. Necrotic tissues, infection, and biofilm should be removed adequately. The fourth principle is we should replace like with like. The best reconstruction uses tissue similar in color, texture, thickness, and function. If the tissue is unavailable, techniques like tissue expansion or distraction osteogenesis can create it. The fifth principle is we should optimize vascularity. What this means, plastic surgeons should respect blood supply. Good vascularity is essential for flap survival and wound healing. The sixth principle is we should preserve both form and function. A successful reconstruction should not only look good, but it should also restore function. Seventh principle is we should minimize donor site morbidity. While reconstructing one area, we should avoid creating problems at the donor site. Eighth principle is to protect the surgical site post-operatively. Healing continues after surgery. Immobilization, elevation, splints, and proper wound care are critical. Ninth principle is always have a backup plan. Complications can occur in any surgery. A plastic surgeon should always be prepared with alternative reconstructive options. And the last principle is innovate new solutions to old problems. So, understanding these principles forms the foundation of every reconstructive surgery, and therefore it should be followed.